your question. Okay, so if you have read and understood, considering it communication skills station, kindly please begin.
Hello, I'm Dr. Atul, one of the surgical doctors. Uh, I'm very sorry to see you have been waiting for so long to see my consultant, Mr. Man.
Okay, yes,
And are you the wife of Mr. Smith?
yes, Mr. X, I'm Mr. X wife.
Uh, all right. I'm one of the surgical doctors. I'm covering for my consultant, and he has been called away for an emergency. And I'm here to see what's wrong and to talk to you. What can I really do for you? And definitely, I'll tell Mr. Maan that you were here, and I can arrange another appointment to meet him. And I know that this is a very tough situation because your husband has come a couple of weeks ago with a tummy swelling for 6 weeks duration, and that is why he was sent for CT scan. But unfortunately, our CT scan machine has some problems and we won't be able to do CT scan today. I'm
But
really
doctor, I
sorry.
don't understand why are you sitting and waiting for CT scan? Why even is it important? Why do you need it? My husband in so much pain, he cannot even breathe properly.
Uh, all right, ma'am, I understand your husband's situation. First, let me explain you why we have requested for this investigation. We know that your husband's tummy swelling is due to the accumulation of fluids inside. And some of the fluids were taken for analysis and it has showed presence of cancer cells. And we need to know that from where this cancer is arising. That's why we have requested this investigation and from where it is coming and how much it has already spread inside the body. Do you understand ma'am, whatever I'm saying?
Yes, I'm understanding, but I cannot understand why are you wasting my husband's time because of this CT? Isn't there any other alternative that you can offer him instead?
Uh, yes, sure, ma'am. As an alternative, we have temporary measures, what we call ultrasound scan. It is just an jelly scan, what we do in a pregnant woman. With the help of this scan, we can find any suspicious lesions inside the liver, as well as any fluids present inside the tummy of your husband. And also, there is another alternative that's called MRI, which is equally good as CT scan. But we have to take Mr. Man's opinion in that first. And the last option is we may transfer your husband to another hospital to do the scan.
Okay, then do that. Transfer my husband to another hospital where the CT scan could be done so that you can really do something for my husband.
Okay, yes, I can arrange the appropriate whatever I can in my hand. I will do. and I will talk to the another hospital's consultant, and I will arrange your appointment with that hospital to that he will not suffer here, and as soon as possible he can get to he can get a date of CT scan in the other hospital.
But the problem is, okay, we'll discuss at the end. Okay, can you please tell, doctor, can you confirm that my husband has cancer?
Uh, well, ma'am, yes, it is your right to know that whether he is having cancer or not. All the single investigation which is with us, which is already done, is only the fluid analysis which has shown the cancer cells. So to confirm the diagnosis, we must have CT scan done and to know uh, from where the cancer is arising and which type of cancer is and from where it is from which stage it has already developed. And that is why we need to do a CT scan as soon as possible for your husband's case.
What are the treatment options which are available for my husband if he is suffering from cancer?
Yes, we do operations for cancers in patients. We think they get better outcomes from the surgery. But in such cases like your husband's case, the fluids present in the tummy suggest the aggressive or advanced stage of the cancer. But in such cases, it would be very unkind to put the patient more suffer pain with only a little benefit.
So what should I do meanwhile? My husband is having so much shortness of breath and he cannot even breathe properly, and there is so much, he's in so much pain and agony. What should I do meanwhile?
Uh, yes, ma'am, I can understand your concern. First, let me explain you why is this happening to him because of the much fluids presence inside his tummy, and the fluid is pushing his lungs. That is why he is not able to breathe well. Uh, I can discuss with my consultant, and I can withdraw. After discussion, I can withdraw some of the fluids, so it will give some relief to him. And moreover, I can also prescribe some medication which will help him to get rid of such amount of fluids.
Okay. How long would I have to wait till we will get to know when you are doing this?
As soon as I discuss with my consultant. Yeah. After this discussion, I will discuss with my consultant.
Okay. Yes. Your closing statement. Okay.
Okay, and is there anything else you want, or you have any queries to ask?
And no, not yet.
Okay, I am here to help you and support you and to dive your hand at any time. If you have any queries, you can contact me at any time. I'm leaving my bleed number with the nurse, and thank you for understanding me.
Okay. Thank you. Just 20 seconds left. Very good. You covered everything within given time. And
Thank
if
you.
you would have discussed moving to a new hospital would cost
Yes,
at least 2 more weeks. And this
all right.
city is being fixed in next week, like just 1 week. And
Okay,
if you transfer the patient to the now bell went. If you transfer the patient to the next hospital, again they'll start from the beginning, and the resources you cannot guarantee that they'll have the good resources, and investigations and everything will again can take more 2 weeks or more, maybe more. So that even that is not going to help the patient in the longer run. So that's the explanation. Very good. If you would have answered that as well, that would have been within given time. Good. Thank you.
okay. So this question